Hi there, so my name is Praveen Raj. So today we are going back with a topic called behavioral therapy. So talking about this topic, it's an actually a topic from the psychiatric and mental health nursing. So what is actually a behavioral therapy? So first we can jump on to the behavioral therapy content with the definition. That is, to treat a problem, we should always have a established professional relationship with a patient or a person to whom we should have the desired change of the behavior. So, in order to for the treatment of the problem, a trained person establishes a professional relationship which results in removing and modifying the existing symptoms of the person. So, these symptoms are referred to the just before we have referred to as the problems. So, these symptoms are modified or removed and promote a new positive personality and helps in the person's growth and development. So, these all are the definition of the behavior therapy. That is, the treatment of the problems is done by the trained person by establishing a professional relationship, and then by establishing a professional relationship helps in the removing and modifying of the existing symptoms, and also helps in modifying and promoting a positive personality and growth and development. So next we can go for the main law principles that are used for the attaining this promoting the positive personality. So the two principles are the classical conditioning model by Ivan Pavlov and also operant conditioning model by B.F. Skinner. So these two basic principles are used for the removing and existing of the existing symptoms and also promoting the positive personality traits. So next we can go for the major assumptions of the behavioral therapy. So first of all, the major assumptions of the behavior therapy are just referred to as the main points of the behavioral therapy given to the patient. So all behavior, that is any type of behavior in any persons, can be learned. That if any type of adaptive behavior or maladaptive behavior in a person is learned from the society or learned by his inner himself. So all behavior that a person learns is adaptive or maladaptive. So these types of behaviors are all learned from his own type of environment. So all behavior is learned. And second point is human beings are passive. That is, any human beings can change his own her own adaptive behaviors can be partially changed and also modified. Next is the maladaptive behaviors are replaced by the adaptive types of behaviors. That is, the maladaptive behaviors are again that are the worst kind of behaviors are replaced by the good kind of behaviors. Next, behavior assessment should be given to the patient in types of current behavior. That if a behavior assessment should be taken for the patient, we should always assess for the current behavior, not for the past behavior or the future behavior. The current behavior of the person is assessed for the behavior assessment. Next, treatment strategies should be planned and analyzed. So other key points should be, while we should always remember while assessment of the assumptions of the behavioral therapy is the short duration, that the behavioral therapy should be so short that it should only go for 6 to 8 weeks, that is about 2 months. Next, while going for a behavioral therapy, both therapist and patient should have an equal role in the providing the behavioral therapy. Next, we should not encourage the patient to think about or more to talk about his past or his previous conditions. Next, we are going to jump on to the behavior techniques that are the main content of this topic. So we can classify this behavior techniques into mainly systemic desensitization, flooding, aversion therapy, and also other three types that are mainly operant condition for adaptive behavior and operant condition for new behavior and operant condition for decreasing the maladaptive behavior, and also last and finally social skin training. So jumping on to the first one of the behavior therapy, that is the systemic desensitization. So it was mainly introduced by Joseph Wall. So in this thing, there are mainly three types of phases, that is relaxation training, hierarchy construction, and desensitization. So into the first one, that is the relaxation training, is usually providing the patient with a relaxation state of mind or relaxed state of body by Jacobson's relaxation technique that helps to relieve the stress of the peripheral muscles. And next is the yoga or meditation for a calm and state mind of body. And next is the biofeedback. So these all are the main relaxation techniques to provide a patient for the relaxed state of mind or body. So second phase, that is mainly hierarchy construction. So in this phase, the patient is asked to list down all his problems or problems that cause usually anxieties from the highest order to the lowest one in a paper. So this will help to help the patient or therapist to provide necessary management for the anxiety causing problems. So third one is the last phase, that is the desensitization. So in this phase, the patient is advised to signal when the anxiety is produced. So if a small anxiety is caused by the patient, the relaxation training is given to cope up with the certain type of anxiety. So this actually helps the patient to cope up with the even the smallest to the largest anxiety and will adjust to the environment. So and second one is the flooding. So in the second one, flooding, the patient is exposed to the phobic stimulus, and with the help of the therapist's guidance and encouragement, a new type of behavior is modeled for the patient. So when exposed continuously to a phobic stimulus, it pressurizes the patient, and when a new support and behavior should be provided by the therapist to the patient, and this will help the patient to reinforce a certain new type of modeling behavior. And the third one is aversion therapy. This is a pairing of pleasant stimulus with an unpleasant response. So these are mainly used in alcohol patients, that if a patient shows an unpleasant response, that is an unpleasant stimulus, if a patient has an alcohol intaking habit, this stimulus can be eradicated by providing an unpleasant stimulus. So if the next time the patient again do this thing, if he provides with an unpleasant response, the patient starts to decline this type of behavior. So this evasion behavior therapy is also helpful for the patient to remove or neglify a certain type of maladaptive behavior in his own personality trait. The fourth one is mainly operant condition for increasing the adaptive behavior. So there are mainly two things. The first one is positive reinforcement, that is usually providing the patient with sweets, gifts, or a small rewards while doing a positive or good behavior. Next one is the token economy. So this is the same actually compared to the positive reinforcement. The only difference is that sweets or rewards are not given to the patient in chance. The patient is usually provided with tokens. So these tokens can be utilized by the patient to buy or earn any things that he can his have on freedom to buy any things with that token. So next, we can jump on to the fifth one of the behavior therapy, that is operant conditioning to teach new behavior. So there are mainly three things in the operant condition to teach new behavior. The first one is modeling. So it is just actually a demonstration by the therapist to how to do a good behavior. Next is a shaping, that is a step-by-step procedure-wise reinforcement of the patient by the therapist. Actually, I contact with the opposite patient. It's a good example for the shaping. The third one is chaining, that is the complete complex task is divided into small pieces that can the patient can easily be approachable for the small steps. There are mainly forward and backward step based on the which he starts. If a patient actually starts from the beginning, it can be called forward chaining, and if the patient who actually starts from the last one, it can be called the backward type of chaining. And next, the sixth type of behavior therapy is the operant conditioning for decreasing the maladaptive behavior. So there are mainly five types of operant conditioning. The first one is the extinction or ignoring. It is actually not looking at the patient or not talking at the patient, following a certain problematic behavior. If a patient usually redeems or shows a certain maladaptive behavior, we should always ignore the patient. So this causes the patient to decrease the maladaptive behavior. Second one is the punishment. That is, we should always give a small punishment for doing a certain type of maladaptive behavior. And third one is timeout. That a certain time should be certain extent for the certain work. This actually causes a stress or pressure for the patient to do the complete work in a certain amount of time. A good example is that children can play after doing their homework. So the children, after completing their homeworks, the parents can give a small leisure time just to enjoy themselves. So this pressure allows them to do their work correctly. So the fourth one is the restitution. It is a restoring a disturbed state to a much normal state. A good example for this, if a patient that who urinals or urinates continuously in his bed or in his room, the patient should be allowed to clean his area or clean his own bedroom. This allows the patient to never urinate again in his own bedroom or in his own bed. So the next one is the responsive cost. So it is used in the token economy that we have already told earlier, that the patient is usually given a small token, that with this token he can buy or earn anything, or he have on his freedom to do anything with that token. So one of this reward is usually taken back if the patient has shown the bad type of behavior. So this causes the patient to never do that habit again. last but least, we are going for the seventh one, that is social skill training. So in this thing, we are encouraging the patient to appreciate the responses, whether it is positive or negative. So this type of training is the usually helpful for the patient to express his own feelings, whether it is positive or negative. And the therapist also can help the patient by expressing the feelings through a role play or a skit. So this will help the patient to identify his or her own feelings. The therapist can easily understand the behavior and also provide a good proper behavior therapy. So this is all about the behavior therapy. It is a small topic under the psychiatric and mental health nursing. So hope this will be helpful for all of you. And just please write down in the comment box about this video and the feedback about the video. If anything that I need to be changed in the next video, that will be helpful for me to make the changes. I hope you all like the video. Thank you for your cooperation. Thank you for hearing up to the last. Thank you.